Hi, everyone.
Hi, Kristen.
Hi, Eloise. How are you?
I'm well. How are you?
Good. I feel like I haven't talked to you in forever.
So long. I'm really looking forward to this talk tonight.
Me too. Oh, well, what time is it there? It's like 8 o'clock, right?
Yeah, yeah. It's absolutely pouring with rain. How is it in New York?
It's gorgeous. But I've actually been on meetings all day for Advocacy Day, but well worth it to talk
Yeah,
about
I saw. Amazing, amazing.
helping bills and issues. I'm just gonna try to invite Michael one more time. Okay, I just sent him another invite.
I haven't done a 3 IG live before, so I'm excited about this.
I've only done one other one. It was actually four of us.
Oh, cool.
So I know it does work, but let's see. Would you mind trying to invite him on your end?
Yeah, let me try. Not letting me.
Okay. And for those of you who are just tuning in, we're talking about the emotional journey of male factor infertility today.
No. We're just waiting for Dr. Schmeichel from Laurel Fertility Care, who is trying to join now.
Well, maybe we can go ahead and talk a little bit about, you know, our own experiences, leading into Dr. Schmeichel joining us. So, Eloise is the founder of Fertility Help Hub, and I know that your infertility issue was male factor, so you have a lot of experience in this area, and you're a mom to three beautiful children who were
Thank you.
conceived via IVF with donor sperm. So, can you tell us a little bit about, what that was like receiving that male factor diagnosis. What exactly was your husband's diagnosis?
Okay, so it was totally out the blue, and I've got him to do a Q&A with me, which we're going to be sharing together, aren't we, in written form soon. And I was surprised at some of his answers. That he's got a very dry sense of humor. He's very to the point, very sarcastic. But thinking about things in when he's actually being serious, what hit him was the way that he was told that he has no sperm from the clinic we went to see was not good. And so that's why it's so key to find a provider that you trust and that you've done your research on. And so obviously we're going to be talking to Dr. Schmeichel about this tonight. But the clinic that we got tested with had never heard of his condition before, which is called Klinefelter syndrome. Um, and so, yeah, if you is he trying to join now? Because we can always switch, come off and come back on if you want to try again.
I just sent the request again. So is Klinefelter syndrome, and we can ask Dr. Schmeichel this, but is that different from azoospermia?
So azoospermia, or however you say it, is no sperm. So you still ejaculate, but there's no sperm in it. And
Okay.
lots of people think that nothing comes out. It still comes out and looks normal, but there's no sperm in it. Um, and so that's azoospermia, but you need to find a cause for azoospermia. And so there can be lots of different causes. And for my husband, it's a syndrome which is genetic, where he's got an extra X chromosome.
Oh,
Um, so which means that he has lower testosterone, which affects fertility. And
oh,
so I think we should ask Dr. Schmeichel in a minute, but I think globally it affects Klinefelter syndrome affects about 1 in 660 men. That was the stat I saw last time I checked, which is quite high. It's one of the leading causes, I believe. And the clinic we saw in the UK had never heard of it, which was awful to be given the diagnosis of no sperm, but not told why that could be. So then came all of the investigations, which took a few months. And then we went to the States for him to have a micro TESE operation, which is a sperm retrieval, where they, as he says, cut both testicles open like a book and go in looking for sperm. And they didn't find any. They did, sorry, but it was never going to fertilize an egg. The head and tail weren't strong enough. So we had donor sperm ready to go and ended up fertilizing my eggs, 24 hours later, after his operation, with my eggs. Sorry, the donor sperm with my eggs.
Wow. Okay. And then did you do so you had frozen your eggs prior?
No, so my husband, I was stimulating in America, and then my husband flew out. He was also having injections in the bum, which I was giving him, which are female stimulating hormones, weirdly,
Okay.
to try and kickstart his testosterone, ready for his op, and his op happened around my cycle. So just the day before my eggs were ready to come out, they said, right, you're going under. So then he had it. We were told it was unsuccessful. We were told to wait overnight. I went in at 6:30 the next morning for my retrieval, and I found out 10 minutes before my eggs were retrieved that the sperm was not going to be used, and we'd be using the donor sperm. And he was recovering with ice packs in the hotel, and so we didn't even have a chance to talk about it. And then I came back and said, the eggs have been frozen with donor sperm. I mean, obviously we talked about it, but he didn't know that that was, final, not going to happen. That's the way we're moving forward. So it was really hard, really hard.
So had you talked about that prior to, the, I guess, making that decision?
We had, but we were always going to the States thinking, well, the operation might work. So it was very strange picking a donor as backup when we didn't know if we were going to be using it. And now I hate the phrase backup because that's what's helped us have our children. Um, and, when you're going through this, it feels like a secondary choice, but actually we wouldn't change them for the world. And I know, most people would say that. So but it does take a journey to get there. And the first round failed with the donor sperm. I was seriously upset, and my husband was, but he admits now that actually he was slightly relieved because he wasn't ready emotionally to go down that path yet because he'd only just had his operation. Someone said he's brave to be open about the story. Yeah, yeah, he has to be now because of what I do. Well, he doesn't have to be, but he's on board for helping other men or women supporting men or whoever it is by sharing the story. What about you?
Me? So I was the issue in our infertility journey. I have PCOS, but I was planning on bringing up sort of like, even when the man is not the issue per se, it still affects them emotionally. And, I think men in that position sort of feel like this helplessness because, the women, whether it's male factor or female factor, kind of bear the brunt of the physical aspects of IVF, and even IUI. So, I think like what I did was I really
Oh,
tried.
sorry, Kristen. I think Laurel are ready to be requested in again.
Oh, perfect. I'll do that right now. So in my case, I really tried to get my husband involved by having him do all my injections because it kind of gave him a job. Because otherwise, I felt so, like it was just all me.
Hmm.
So he did that and he took it very seriously. Oh, Dr. Smickle is logged in as himself. Okay, hold on.
Good that he did that because a lot of men, my husband was not going to do my injections.
Hi, Dr.
Hello.
Hi, how are you guys doing? I'm so sorry for the delay in kind of getting back in here, so I
Oh, no,
apologize.
no worries. We're all here now. Eloise was just telling us, so her husband had male factor infertility, and the reason for his spermia, it was Klinefelter syndrome. And she was saying that her clinic in the UK didn't even know what it was, and so she ended up going to New York, and he had the micro teeth
TESE.
Section.
essay,
Hmm.
and it was unsuccessful, so they ended up using donor sperm. And obviously now, I don't want to speak for you, but you said your children, you couldn't picture having. I feel like the more donor conceive, the more donor parents I speak to, they say that you could never picture having another child than the one that you have, but it was an emotional journey.
Mm-hmm. I think just to add to what we were just talking about before we look at the medical side of it too, you were asking, how he dealt with that, and you were talking about how you involved your husband in the process. My husband said that he felt very removed from it because he felt that not only was another man facilitating his wife getting pregnant, he wasn't then carrying the pregnancy. So whereas with egg donation, the woman has a chance to carry, he didn't have that bond. So at different milestones through both the pregnancies, he found things like scans quite difficult, the uncertainty.
Yeah, and no, I mean, I can imagine. And Dr. Smichael, I was saying that our infertility was my issue. I have PCOS, but I think because the physical aspect of IVF primarily falls on the female. My husband felt like the sense of helplessness of I want to be involved, so I actually gave him the job of doing all of my injections. He's way more type A than I am, so it was actually a good job for him because he was able to keep on his make sure we did everything at the right times and all that stuff. But
Did he do the mixing as well?
yeah, he did everything.
And
So
the trigger shot?
yeah, I think so. Yeah,
Wow.
all a blur now, but I felt like that was a good way to sort of get him involved because otherwise I felt like the infertility was my fault. I had to take the injections. I had to go to most of the appointments. So at least it was a way for him to kind of feel a part of it. But we were talking about Eloise's husband's diagnosis, and I had asked about azoospermia and the different causes. So maybe you can speak to that a little bit, Dr. Smichael.
Well, I think, just first, thanks for the invitation to kind of join. But the other thing too is just kind of touching briefly about what are some of the causes, and then I'll talk about Eloise's situation directly. I think one of the things that we need to know is just that Klinefelter is actually one of the causes, means that genetically he was born with not a lot of sperm. In some Klinefelter men, you may end up having some sperm within the testicle itself, and that's why they recommended the microdissection. But that's one of the causes. Azoospermia may also be caused from someone with cystic fibrosis. Theirs is different because it's more from an obstruction rather than from something that was actually going on. And so therefore, in men with cystic fibrosis, you can go into the testicle, do aspiration, and you can get sperm from there. And that's actually much more successful. Basically, vasectomy is another cause of azoospermia. You don't think about it as much, but that's where someone actually had children before, had a vasectomy, and now is azoospermic. And sometimes it causes scarring, so therefore you can't get sperm, and you may end up having to do a TESE, or that may not be successful either. But you definitely don't have any sperm in the ejaculate, which is the definition of azoospermia. Sometimes you'll end up having injuries, causing azoospermia, because let's say you end up going through a football or a soccer or some sports related injury where you end up getting injured in the testicle, and you end up having torsion of that testicle. That sometimes can cause problems in terms of function as well. Sometimes you just don't know in terms of what's going on that's causing it. So the unexplained as actually another factor as well. So those are the mumps is another one that's not as seen as often now, but things that can cause the azoospermia. So the key thing as far as the definition is just basically no sperm in the ejaculate. Ones where you have obstruction is where you end up having either vasectomy or you actually had cystic fibrosis. Those are ones you can get sperm. but Klinefelter's, torsion, all those are ones where there's not a lot of sperm. So those are the common causes of azoospermia. Just talking about Eloise's husband and seeing how he feels is actually relatively common in terms of men who basically feel that they've gone through the process and now they're not contributing. And even though they may be going through and you're helping with the injections, and I think it's the same fear that you're not a part of this child's life. And even though you may feel and love them and everything else, it's just that you're not contributing because genetically there's not that bond. And as she said, if it was the other way where you went through egg donation, you're carrying that child in your body. So therefore, from a societal standpoint, everyone then will know and feel that you're part of this. But for men, there's not a lot of support and there's not a lot of hope or help around that. So they're dealing with that process very separately. And I think that's probably one of the things that she found, or at least he spoke to. But again, it doesn't change how he feels. It's just that it's a support around that.
Mm-hmm. Do you see many men who have success with the micro-TESE operation with Klinefelter syndrome?
Unfortunately, not very many. And the reason for that is just that with Klinefelter's, it all has to do with the gametes in utero, how they migrate, and they're just dying off during that process. So therefore, all the germ cells are actually not going to actually line up the way they're supposed to. And it's the same thing with women who have Turner syndrome, where they're basically not going to have any eggs when they're born. So therefore, they may have started out with some that within that tract, but they just never get to where they're supposed to go. So I'd say probably in less than 5% of men, you're going to end up having sperm that you can identify. It's always worthwhile to try because it allows you to end up having that genetic connection. But unfortunately, we're always talking about using donor backup as a choice.
I think that to your point about feeling involved in the process, even though the operation wasn't successful for us, we're just in the process of doing a Q&A all together. And so I've asked my husband some of these quite emotionally led questions. And I asked, in hindsight, do you wish that you hadn't have had the operation? And he said, obviously, hindsight's a great thing, but no, because he felt that it was in his power to do everything possible at a one-shot chance of having a genetic child. And if he hadn't, he would have always wondered, should we have gone down that route first? I mean, obviously feelings do change once your children are here, but I think there must be many patients that you see who want to just do everything in their power to know that they've tried what they can.
So speaking to that directly, I think the question you may be asking him, or maybe the question he might actually answer differently, is just does he think that he should have gone through the process first before you were committed to using the donor sperm, so at least he'd know what was going on? I think that mourning process is very different. Had he gone and done an aspiration or the micro-TESE and then they found no sperm, and then you had the chance to kind of mourn that process to say, well, there's no sperm. And the reason to do that, let's say you did the micro-TESE and you found some sperm. You can freeze some of that sperm and use it later on. Or you can say, okay, we found it, so therefore now we can plan your cycle to go and then do the same thing, realizing that you'll either use the sperm backup, or there may not be any sperm there at that second aspiration. But at least you've gone through the process where he's actually then committed and he's part of that decision. I think in a situation like his, the grief is just that you're going through with this hope and expectation, even though it's a small one that they're going to find sperm, but never grieving the process and given that opportunity before the commitment was made to fertilize the eggs. Because once that's done, there's not really any choice. Then you have these embryos to deal with. And I'd imagine for you, you're excited, you want to get pregnant, but then he feels like he can't really separate his joy and his actually his excitement that he shares with you, because he never had the opportunity to grieve his process. Mm-hmm. If he'd done his first and then found out there's nothing there, it would have been much, I wouldn't say easier, but it would have given him more time to separate those two events. And that's the difference.
So this was 5 years ago, and we were told that
Mm-hmm.
I should have my egg retrievals. You know, his operation was planned around my egg retrieval, and I had the egg retrieval
Mm-hmm.
the next morning, and we didn't know about
Mm-hmm.
the sperm that was going to be used until 10 minutes before I went under.
Mm-hmm.
Have things changed now so that you don't necessarily need the eggs fresh?
No, not saying that part of it. The other thing that may have been different for you, and this is a logistical thing, is just that, from what I'm understanding, you live in the UK, you came to the US for treatment, and so therefore, you really didn't have many choices to separate those events. If someone were living, say, in the United States, what they could do is do the event where they aspirate the sperm the month before, find out if there's anything there, and then basically make decisions based on that. For you, you're probably timing things a whole lot from a logistical standpoint because you have to make flights. You have to basically make arrangements for for everything else to get there. So that's a different arrangement process than someone who basically is local. Or you might make the decision that you're going to do that separately. So it's not to say that the decision is made any differently, nor is it saying you could make that decision where you're going to freeze the eggs and not use them that same time. I'd argue that probably, I'd still want to fertilize them as fresh as can because you may end up having better success that way. So I think it's more making logistical decisions around having each of you mourn the process that comes about separately or differently.
Mm-hmm.
Does that make sense?
Mm-hmm. 100%.
Mm-hmm.
So going back a little bit further, Dr. Smigel, I mean, in your experience giving couples a male factor infertility diagnosis, what are some of the reactions? Like, do men often need, I know everyone's different, but do they need a little bit of time to kind of process, or what's your experience?
That's a $60 million question because from life isn't fair, and men may not actually presume or expect that they have anything to contribute to it at all until they're faced with it, and so it's a pretty big blow, and so therefore it may take some time to make that decision, and that's one of the reasons why I was saying that in Eloise's situation, they knew that he had Klinefelter, so therefore there was at least some knowledge there before. Whereas some men who basically they either don't want to take a sperm test because they just don't want to know, and so they'll actually have their partners go through a lot just because they don't want to know that information. But when they're faced with that decision, they may end up taking some time to kind of basically accept things. I think the hardest process is basically when they go through and find out there's no sperm and they feel that there's no hope in them parenting. And I think it's different in terms of how it gets processed. And I think a lot of it has to do with that familial structure in terms of how they're going to grieve through that together. Because if they have a strong relationship, they may be able to manage that separately or differently, because it'll take a lot for both of them to go through. Oftentimes what ends up happening in any situation is there's always some sense of blame. One of the things you're saying is that you blame yourself for having PCOS, whereas it's not a blame, it's just a disease, and it's not any control you had. And I think that's actually often the situation where it causes fractures in couples where one's taking, well, it's your fault, my fault, and that part of it isn't really helpful for the process of parenting. So that's the thing that's different. Mm-hmm. So different people will actually walk through the process separately and grieve in a different way. With men, though, with low sperm count, or ones that there is hope in terms of you can actually go into the testicle and at least get sperm, there's a lot better response because they're feeling like well, there's still something that I can do. So it does depend. It does vary.
I think the other thing, just to add, is that it wasn't obviously we found out about his syndrome because of trying to conceive, but mm-hmm. his syndrome has other effects to his life as well, mm-hmm. in terms of cancer prognosis in the future, mm-hmm. and life expectancy. He has hormone mm-hmm. replacement every 2 months because of the operation that he had in Klinefelter's and his levels dropping, and that has horrible side effects that have come with the condition that he's learned that he has. So I'm sure you must have patients who also sort of unravel things they didn't know about themselves through trying to start a family.
Oh, definitely. And I think that's actually one of the hardest things to kind of grapple with because, you know, we go through this process feeling like everyone conceived through infertility or through IVF. The majority of the world basically goes through the world having normal intercourse and getting pregnant. So therefore, they never have to deal with all the things that may be still underlying and going to cause problems later on. They may face it later on. One of the things in going through the process for evaluation for a lot of the fertility challenges is just that it's going to then uncover problems that arise in on one or the other side, and they'll have to grapple with it. And as you said, Eloise, some of them are going to have long-term consequences. So therefore, a woman going through finding out that she has endometriosis, she may not be symptomatic, and then basically find out, well, that's scarred her life, and she's not going to be able to have kids. That's something she has to deal with and grieve, plus all the other complications related to treatment for that as well. So, yes, infertility does uncover things that has life consequences that we have to kind of grapple and deal with the long-term consequences of those things.
Absolutely. So a question for both of you that a bunch of our community members asked. So how can someone best support their male partner that's navigating male factor infertility?
I think the best way to answer that is to basically make sure that the couple actually has good foundation support, and that you're not just I think of everything as a stool, a three-legged stool, and it's the same way when you're factoring other aspects of it as well. You need that emotional strong leg to support the other two to basically function, and so therefore, if any of them are unsturdy, then the stool is going to falter. And for me, one of the things to kind of really talk to patients about is that the process of going through and getting pregnant is simply just a process. There's a much longer process afterwards in terms of basically getting pregnant, delivering, and parenting that child for however many years. The child doesn't care the cost of you going through that, both the physical or financial cost of going through, nor should that be the child's burden. But at the same time, those processes, they may have long-term consequences. And so therefore, the healthier that relationship, the more you focus on that relationship in terms of having social support and other means to support that process, that's going to be helpful. And that may mean, having other family members involved, communities involved, support groups involved for both, because I think it's going to be really pretty critical. Men and women grieve differently, and they actually look at support differently, but it doesn't mean they don't need support. And I think that's a really, really important thing to kind of understand, because, it's going to be something that's important for both of them to go through.
From my experience, what I found difficult was the fact that I wanted to talk about it from the moment the diagnosis came. I wanted to call my family immediately. I was in floods of tears. We both were. And my husband said, I don't want you to tell anybody. I don't want you to tell anybody until we know what's going on. Mm-hmm. And so sitting on this information, not being and pretending you're fine, was really difficult. Cancelling social engagement, people asking why, breaking down, that kind of thing. And I was led by him because it was his diagnosis. So my advice would be work out as a couple what you're both comfortable telling people and who you're comfortable telling, so that one of you doesn't say something to someone and then the other one gets upset that you've spoken to that person about it, or whatever it might be.
But that same advice should be for all parts of that relationship, not just getting pregnant. It's the same thing about finances, same thing about basically shared decisions, same thing about secrets in general. I think as a couple, you share secrets that you don't share with the rest of the world, nor should you. But at the same time, you may share it with different people. And what you need to do is to understand and respect that other person's boundary, to say that, well, I don't feel comfortable with the rest of the world knowing this about me, because I'm not comfortable at how it basically reflects on myself, because I haven't processed and dealt with that part of it. And so if the world is going to think less of me because, they think that I have no sperm, it's something I have to deal with. And until I'm comfortable dealing with it, then I can share it with the rest of the world. it isn't up for anybody else other than for me and for my partner to kind of go through and basically, you know, uncover or basically unmask that secret. And you know, it's you know, it's the same process as somebody who's you know, um, gay, and then you know they get outed before they're comfortable already. It has significant and profound consequences that you have to kind of grapple and deal with that are not yours in control. And then until you're ready to kind of control those things, it's not something anyone else should share for you.
Absolutely. Yeah, I feel like there's almost more of a stigma. I think, you know, not only are men sometimes not as comfortable sharing their emotions, but also I think when people think of infertility, they think of female infertility. And
Mm-hmm.
so, you know, I've read a couple of different stories. I just published one like 2 weeks ago about, you know, and you said it was like a gut punch or a big blow to some of these men because they're just like not expecting it because that's not what society, I mean, we're kind of told like men can get a woman pregnant until they're 90 years old. Like that's kind of what we're led to believe from movies and pop culture and all that stuff. So it just kind of adds to the shame and stigma that I think a lot of men feel.
I think also being told that you've got no sperm for my husband, I'm sure that many other men feel like this. He felt like he was demasculated and he
Mm-hmm.
didn't feel a man. So it took him a while to kind of it's amazing how many people make jokes about sperm without realizing it's not always a joke. So we've been at so many social events where people have said things like, "Are you firing blanks?" or whatever it might be. And actually, he then turns around, even if it's not directly to him, and says, "Well, actually, yeah, I am," because he's got quite a dry sense of humor. But people feel so uncomfortable when they've said something in jest, not realizing that actually some people might be suffering with conditions or situations in their lives that they don't that other people don't know about.
No, I agree. That's definitely true.
Yeah, I mean, Eloise and I both have IVF twins. Kind of like the do they run in your family
Mm-hmm.
question you'll get from the most like well-meaning stranger, and you're like, am I really supposed to go into how you know they were conceived?
Well, here's one that I would actually bet comes up. You know, like you know, basically, you know, Eloise's husband will let you walk his kids around, and someone say, "Oh, they're so beautiful. They look exactly like you." And then how do you handle that? How do you deal with that? Because you
Mm-hmm.
know. It's the same thing with women who go through egg donation. The same premise and everything else. It's something that we talk about when we talk about it in terms of third-party parenting with couples, because it's something that it's they have to kind of think about and process that information before, because they have to be willing to basically figure out how they're going to accept that information, because it's going to come up. You know, the bottom line is that she got pregnant, she delivered. The presumption is that he's the father, he did it. So therefore, you know, there's a lot of presumptions we make about parenting in general, and the society makes for us and puts on us. And I think the key thing is just that until we unravel how we process that information within ourselves, it's going to be one of those things that, you know, there have some challenges that we have to kind of bring in.
Mm-hmm. I think also even after, if you know whatever route you go down, even after birth, I had you know I spent two days giving birth, and then had the first thing I did was ask him if he was okay because he was upset, and I didn't know whether they were happy tears or whether he was how he was feeling about it. But even
Mm-hmm.
going for postnatal checkups at the doctors, they didn't read my notes because they'd ask questions like, "Are you
Mm-hmm.
using contraception?" And so I'd have to say, "Well, actually, my husband's infertile, so you don't need to worry about it."
Mm-hmm.
Have you been
And
asked
those,
questions like that, Kristen?
Well, I just think in general that postpartum care isn't very, you know, focused on the mother or the father. I think it's usually about mostly about the baby. Actually, I had full blown postpartum anxiety, and my kid's pediatrician is the one that flagged it through like a survey, you know, but it wasn't my actual OBGYNs that, you know, discovered it. So yeah, I think there's much to be desired in that in that department.
Did we have some questions that came in earlier as well?
Yeah, we did get a couple questions. I think one of the most relevant is probably for those who have male factor who, you know, who do have sperm, but it's just a quality issue. Are there any lifestyle or supplements, you know, modifications that they can do in order to increase their fertility?
Well, I'll start out with that one, and then Eloise can actually provide any other information. That I think one of the key things, it depends on the cause, and it also depends on the severity. So with those who actually have some diminution in either quality, volume, or basically the motility of the sperm. It may be lifestyle dependent, so therefore they'll have to modify their lifestyles. If you're smoking cigarettes, then that's actually one thing that can contribute a lot. So therefore, the thing to do is to stop. If you drink excessively, eat different things excessively, then that may be things to modify. There are some supplements you can take that will improve that particular function, whether it be motility, morphology, or the count. So that's important to know. Sometimes, given men, something like Clomid, depending on their hormone levels, may end up having some improvement in quality. So it all depends in terms of what's actually the cause of the problem. Something that is, anatomic, cystic fibrosis, that's not going to change. You can't fix that. So it means that they'll have to go through the process in terms of aspirating the sperm. So I think it's going to depend a lot just in terms of what particular cause is underlying the issue, and then going from there. There are a lot of supplements that are being sold that some of them will have benefit in terms of improving some of the parameters. So therefore, it doesn't hurt to take any of those. And I think the key thing is just going to be looking at your partner and seeing where she's going to be in that realm. Because again, if she's older and you're taking supplements take a long time to have an effect. So therefore, what you may be doing is changing one situation for another, and then you end up having a situation where both are going to be compromised.
Great. That makes sense. Someone had asked about testosterone therapy for low T. What are your thoughts on that?
Low T for infertility.
Yeah,
Um,
testosterone therapy for, I guess, as a treatment for low T.
so let me make the distinction between testosterone therapy for a lot of the physiologic effects, like decreased libido, decreased strength, decreased drive, if you will, or decreased just overall health and well-being. That's one thing where testosterone can improve. However, the one thing testosterone does more than anything else, if there's any sperm that's there, exogenous testosterone of any kind is going to diminish it. So therefore, one of the things that we see often in terms of men who, don't see it as often now because many of the testosterone supplements have been banned, it's just that you go from a situation where you have a little sperm to no sperm. And there's some parts of the world where, injectable testosterone is used as a contraceptive for that reason. It will diminish sperm count. So that's important to know. So for other symptoms, it's great, not for fertility of any kind, because that's the first thing you want to stop.
There was another question that came in, which was around treatment. So what's the cutoff point for when you would use IVF, and then move on to ICSI depending on a sperm issue?
In terms of going through ICSI, I think that it depends a lot just in terms of the number of eggs you have available, and also just in terms of some of the procedures you may be doing. If the sperm parameter, so from a strict standpoint, if the morphologies are very low, so therefore there are different criteria to evaluate morphology, but let's say the morphology is 1/2 whatever the normal is by whatever parameter you're using, whether you're using the Kruger criteria or the World Health Organization criteria, then most people would recommend ICSI because there's something that's going to be within each of the sperm that's going to affect things. Another thing is absolute count. If you have less than 1 million sperm, you need to do ICSI. There's just not going to be enough sperm that's going to be used normally for you to fertilize conventionally. And again, the other thing is just that if there's not a lot of eggs, many times we'd recommend using ICSI only because we want to make sure we maximize fertilization. So those are processes you can go through. Those are general things. There are always going to be specifics. Men who had a vasectomy for a long period of time and then actually had a reversal, many of the sperm just not going to function very well. So they'll actually have to do ICSI. Anything that's aspirated from the testicle is going to need to have ICSI because they're just not going to function in the same way. So therefore, you have to have ICSI to fertilize eggs from that standpoint. So
What
those are
about
probably the easiest way. I'm sorry, what?
what about frozen sperm? Would you use ICSI for frozen sperm?
Not necessarily, because anything that's been ejaculated has gone through the full maturation process. So it still comes down to just in terms of how many normal moving sperm there are. So if you have a high sperm count in the sample that was frozen, then you may end up having a high count after you actually thaw, and you may not need to ICSI from that standpoint.
Interesting. Someone just asked, is it normal for motility to vary widely by sample?
It does. And that's something that we actually talk about with patients a lot. Anything that you do, remember, it's a process that is going to be affected by activity. So therefore, let's say, you did ejaculate for a week. What will happen is just that means that there's a lot of sperm that are probably dead or not moving that's inside that ejaculate. So therefore, that's going to affect motility. Let's say, basically, you're a chronic, alcoholic, or you're a chronic, you're a marijuana smoker. That may affect motility as well. It just slows things down. So there are definitely things that are going to affect anything. And then if you stop those activities and then, get another sample, or you shorten the interval of when you're collecting the sperm, those things are going to improve the motility. So it does vary.
Do you tell men to abstain from ejaculating before you do the testing, or before you
We
get
tell So what we tell men to do is to basically ejaculate frequently for a while and then abstain. There's some men who will say, okay, I'm going to abstain for a month, then come in, ejaculate, and then come in 5 days later, 3 to 5 days later. And so for that process time where they didn't ejaculate for that time, also may affect what is in the testicle. So therefore, we try to have them, at least, we do want them to have a 3 to 5 day window where they're not ejaculating when they produce a sample. But we wanted to have some sort of normal sample before so we know what's going on. So that's the primary way in terms of looking at things, especially when we're going through procedures like either IUI or IVF. We want frequent ejaculation before because we want fresh, healthy sperm for the process.
Makes sense.
So someone else is asking about stress and how much that affects sperm count.
Questions have come up around stress, bike riding, smoking activity, and I think it is very individualized in terms of what those effects may be. Some people handle stress by basically perseverating, and therefore it's going to affect a lot of the hormonal profile, so therefore that may affect sperm count, and that's important to realize. I think more so than even the effects on in women in terms of eggs, only because basically, men make sperm every day. If you do something that's going to diminish that sperm production for that day, you're going to actually impact the count. So therefore, there's a thing. If you have a cold, if you have a flu, if you get sick, those are all going to impact the sperm count. So therefore, those are things that may influence things in a day-to-day event. So the thing we want to try to do is to basically keep things as even and as calm as possible.
That makes sense. What else? And you kind of covered the lifestyle changes and supplements. Are there any specific supplements you typically recommend, or?
There's such a variety of them now. So therefore, before there used to only be Proxy. Now there's Fertile Blend, Fertile One. There's a lot of places that actually have more proprietary things in them. So therefore, many of them will actually have common elements in terms of basically, L-arginine. They'll actually have CoQ10 and some other products in them. So those are the primary things. A lot of the antioxidants. So those are the primary things to have inside any of them in common. But, all of them are going to act relatively the same.
But that's a good point, isn't it? Because again, when you're trying to conceive, we were looking at treatment. A lot of women take supplements and men don't necessarily think that they need to. My husband said he
Exactly.
didn't.
Yeah.
Yeah, and
Well,
maybe
here's
there's
the
a stigma
situation is
around
very different, and I think that's actually common. So therefore, I know that you probably talked about it with him, and there's not a whole lot we would do. But you're right. A lot of men will actually take supplements and actually take it for a short period of time, not realizing that the sperm cycle is 3 months. So if you're doing something for a week, you might as well just not take it. So therefore, you need to be consistent in terms of taking it. And women will take supplements, for years. So therefore, men need to basically, join the wagon.
Yeah, I had to fight to get my husband to take a multivitamin. And now, with PCOS and I have a thyroid disease, I'm like realizing how important supplements can be, in specific cases. So,
Yeah.
actually, this is a question that we got on Instagram as well. Does Zoloft and other antidepressants have negative effects on sperm?
They both can. Wellbutrin is one thing that we know actually has the least effect. Zoloft, Lexapro, Prozac, we know may end up diminishing drive and may actually impact motility more than drive. So therefore, that's important. Yes, they may have some impact. Does it actually affect the sperm count itself? There's not enough information to say that part of it, but in a couple that's not going through IVF or not going through assisted reproduction, and they're just having sex, then Zoloft, all those products may end up having a role and may impact them, their opportunities or options in terms of conceiving. Something important to say that you shouldn't stop. You should need to find out, and you may have help, because the last thing you want to tell somebody to do who's on any of those medicines for a reason to stop those medicines, because you may change one situation for another. So
That's important.
Mm-hmm.
I think that was pretty much all that I had. Eloise, did you have anything else?
No, I think we've covered everything that came in before. I think that was so thorough. Thank you so much, Dr. Schmeichel and Kristen, for sharing your experience too.
Well, my husband didn't have the issue, but I really appreciate. Tell your husband thank you for being so open, and he's actually sharing his. We're doing like a little Q&A with him on our site next week, so that's exciting too, because I think men don't open up nearly enough, so I appreciate it. And
Well, originally he said yes, and then he said, I don't feel comfortable doing it, and I'd already emailed him the questions, and then he sent them back to me all done this morning, so he changed his mind.
That's awesome.
Well,
So don't change my words.
Well, thank you, Dr. Schmeichel. I always learn so much on these lives, and appreciate your time.
Yeah,
no,
thank you.
not a problem at all. Thank you guys for actually inviting me, and hopefully we can kind of continue providing information for patients to kind of use. So it's helpful.
Awesome.
Great.
Have a great
Thank
rest of
you.
your day.
You too.
Not a problem at all. Take care
Bye,
now.
everyone.
All right.
Bye.
Bye-bye.